welcome back to another Facebook Live broadcast. My name's Sarah King. I am a physical therapist and founder of Invigorate Physical Therapy and Wellness here in Austin, Texas. And the goal of my practice is to help empower people who have been diagnosed with Parkinson's, like yourself, with resources and information that they need to feel back in control of their diagnosis, maximize their independence and their vitality, and really just live the best life that they possibly can. And today we are covering a really exciting topic, depending on where you're at in your journey, and that is all about Parkinson's medications. We're going to call it Medication 101 today. And I get a lot of questions about Parkinson's medication, when to start, what to take, what it means to take medication, what it helps with, what it doesn't help with, all those good things. So I'm going to be covering the question, when to start medication, the top 5 medications that are most prescribed for Parkinson's, and then talk a little bit about why medication should not be your only treatment avenue. So as you guys get checked in, just say hello in the comment section below. We've got myself and my wonderful community manager, Lauren, helping out, answering questions in the comments. So tell me where you're tuning in from. Say hello. I would love to hear from you, just to know that you guys are out there. You can always give me a thumbs up, a big heart, anything that inspires you right below this video. So I do want to say before we get started here that these broadcasts are simply meant to be for educational purposes only. In no way am I able to give you individual advice on your Parkinson's medication or really your treatment plan in general, since you're not under my plan of care as a clinician. And so take this information, write down, take notes, and take it back to your healthcare team, your movement disorder specialist, your physical therapist, so that they can help you fine-tune your individual plan of attack. So I just wanted to make sure that everybody was very clear on that. So as you tune in, welcome. Just let me know you're here in the comment section below, and we'll just go ahead and roll right into it. So the first thing that I wanted to emphasize is that medication does not slow the progression of the disease, okay? So to really hit home on the importance of medication and exercise, medication will address your symptoms, but it does not slow the progression of your Parkinson's. So the only thing that's been known to slow the progression of your Parkinson's is exercise, and exercising in a way that is intense and specific to your Parkinson's disease and your Parkinson's symptoms. So exercise is neuroprotective, which means that when you exercise, there are certain chemicals released that actually protect the brain cells that you have. And in Parkinson's, as you likely know, the area of your brain that produces dopamine starts to degenerate. And if we can protect that as much as possible, then that's the number one key. Because all Parkinson's medication does is try to preserve the dopamine that you have or mimic it. So that's what it means to be exercising for Parkinson's, and exercise is medication because it will protect your brain. It also rewires your brain so that you can do movements better and more efficiently. That's called neuroplasticity. So the key is, if you can slow the progression of your disease, then you can take less medications overall. And obviously we want to be taking as few medications as you can to be optimal and to be functional, since some Parkinson's medications can obviously have some side effects when taken over the long term. So if you have questions about that, let me know. But that's why my mission is so important to me, which is spreading exercise for Parkinson's all across the globe, and making sure that you guys have resources that you need to be active and healthy. So I created a free 30-day Parkinson's movement challenge. It challenges you to 2.5 hours of exercise a week, which comes out to be about 20 minutes a day. And in order to maximize your function, and that's what the research says, 20 minutes a day for 30 days can actually help you improve your quality of life, feel less hindered by your Parkinson's symptoms. So if you haven't taken our movement challenge, you can go to invigoratept.com/30-day challenge. I would love to have you along. Last time I checked, we were at around 1,800 people had taken the challenge. So I would love to have you be a part of it. Maybe some of you guys have taken it out there. And Lauren's going to give you the link below, but you can also find that link above, below, sideways to this video, depending on when you're watching it. Okay, so I see Nora checked in. Hello, Nora from Ontario. Welcome. You're always in here. So good to see you. Okay, so here's what the rundown is of Parkinson's medication. So your medication should be part of a larger treatment program. So there's medication, then we also have support groups, exercise programs, rehab, so physical therapy, speech therapy, occupational therapy, and good nutrition, and potentially sometimes something surgical like deep brain stimulation. So medication plays a small part in your overall treatment plan, and it can also be one of the most time consuming when you're trying to get all of your levels ironed out and whatnot. We're going to talk about that here in a little bit. So in order to find your optimal treatment medication, you're going to want to consider a few things. You're first going to want to consider your symptoms. Second, you're going to want to consider your age. Third, you're going to want to consider the stage and the severity of your symptoms and of your disease. And then your level of physical activity. So all of these play together in how much medication you're taking, potentially what kind of medication you're taking, and can change over time. So you're going to probably have a dosage at the earlier phases of your journey, Parkinson's journey, and those will change over time. So it's very rare for someone to be taking the same medication dosage and type first year after taking medication versus 5 years in, 10 years in, 15, 20 years in. And if that resonates with you, you can just give me a thumbs up if your medication regimen has changed over time. Hi, Sharon. Hi from Montana. Hi. Okay, so I wanted to recommend a really great book for you guys if you haven't read it yet. It's called The New Parkinson's Disease Treatment Book, and Lauren's going to give you a link down below. But it's by Dr. Eric Alskog. I can't say it, but we'll put his name in the notes. And he actually dives really deep into the medication question, as well as a lot of other treatment options for you. So the book is about $30, and it can come in really handy as you're going through a lot of this exploration, because I'm only going to touch on the superficial level, and then if you guys want to dive deep, it's really going to be up to you to research it and to pull it all together in your plan. Okay, hi, Dr. Tyler Tracy. Welcome. I'm not sure if I've ever seen you in here. Welcome, welcome. I always love having another PT in here. Okay, so let's tackle the question, when is the right time to start taking your Parkinson's medication? Something that I always say is that just because you have a Parkinson's diagnosis does not mean that you have to be on Parkinson's medication. Now, realize that taking Parkinson's medication, again, does not slow the progression of your disease. So the way the medication works, when you take something like Levodopa or a dopamine agonist, which we'll talk about here in a little bit, is your brain has produced less and less dopamine over time. It's a brain chemical that helps you move. And by the time you are diagnosed with Parkinson's, you've lost potentially 60 to 80% of the cells that produce dopamine in your brain. So when you're thinking about medicating for Parkinson's, the goal is to replace the lost dopamine. It's not to slow the progression of the disease, it's to replace the dopamine that is low in your body. And dopamine helps you move. So when your dopamine levels start to drop, movement is harder. You feel stiffer, you feel slower, it's harder to walk. Those types of things. So that's the dopamine correlation, and that's the goal of medicating for Parkinson's. So when is the right time to start taking Parkinson's medications? The right time depends really on the severity of your symptoms and how much your symptoms are limiting your ability to participate in your daily life. So if you're still working, Are your Parkinson's medications inhibiting the way that you function at work in a way that's detrimental, potentially forcing you to consider an earlier retirement? That might be a good time to start a Parkinson's medication if it can help you reduce your symptoms and prolong the amount of time that you can work. Is it interfering with your ability to exercise? Since exercise is the only thing that can slow the progression of the disease, if you can't be exercising, then it's potentially time to consider starting to take a Parkinson's medication so that you can achieve high intensity exercise on a regular basis so that you can protect your brain as much as possible over the long run. Obviously, an important philosophy of the right time to take medication is your philosophy about medication. I know we're in Austin, we're a very liberal city, a very homeopathic city, we're a very natural city most of the time, and I have a lot of clients who don't want to start on a Parkinson's medication because they're afraid of the side effects. And we're going to talk about side effects here in a little bit, and I've written multiple blog posts about the side effects of medications. But sometimes taking small doses of medication earlier in your diagnosis, when you're really trying to maximize the amount of things that you're doing in a day, can be a net positive for you so that you can improve the quality of your life and achieve and stay active and stay involved in the community and stay participating in the things that you want to participate in. So you're not alone if you want to minimize the amount of medication you take, but think about it as just a tool in your toolbox, and you and your healthcare team can make that decision together based off of your philosophy about medication, the severity of your symptoms, your age, your disease process, and all of those good things. Okay, so we doing good? I see some thumbs up. So those are, if you have any questions as we go, by the way, put them in the comment section below. I'd love to try and tackle them. If I don't get to them live, we can try and tackle them after we're done. So the next thing I want to hit on are the 5 main types of medications available to treat Parkinson's symptoms. You've probably heard of some of these, but the first one is Levodopa. The second one is a class of drugs called Dopamine Agonists. The third are medications that inhibit the breakdown of dopamine in your body. It doesn't actually replace dopamine, but it inhibits the breakdown of it. The fourth one are a group of drugs called anticholinergics, which is a little bit less common nowadays. And the fifth is something called Amantadine. So we're going to cover these 5 different types in depth. And by in depth, I mean where I'm going to give you the lowdown on them, and then you can take notes and take them back to your healthcare team. Okay, so the first group of drugs are levodopa medications. If you are on levodopa, carbidopa, give me a thumbs up. Or if you've ever been on it, most of the time this is what you are prescribed when you are diagnosed with Parkinson's. So brand names include Sinemet, Parcoba, Rytari. Duodopa is the new injection that goes into your stomach. And there's also inhaled levodopa, which is in clinical trials. As far as I know, it's still only in clinical trials. So those are levodopa, carbidopa. The levodopa is a precursor to dopamine, which just means that your body breaks down the levodopa to form dopamine. And levodopa is often paired with carbidopa, which protects the levodopa from being broken down and also helps to decrease the side effects of levodopa. So most of the time, levodopa is the most helpful for stiffness, slowness, and tremors. It can also help with dystonia. It can also actually help a little bit with anxiety and panic. Those are non-motor symptoms, which means that they're not kind of movement related, but anxiety and panic can actually respond pretty well to levodopa medications. So the best outcomes with levodopa combine medication into a program early on to improve function and ability to participate in an intense Parkinson-specific exercise program. So like I said, taking a little bit of medication to help loosen you up and improve your ability to participate in exercise in your daily life is the main goal of taking a levodopa drug. Side effects definitely can come with levodopa use, and the research suggests that about 50% of patients have motor fluctuations or dyskinesias over the course of 5 years after starting levodopa. However, there are ways to minimize dyskinesias, and if you're minimizing your dosages of of the levodopa, then by exercising and eating right and having this comprehensive plan, then if you think about the cost-benefit ratio, not taking Parkinson's medication but not being able to fully participate in your exercise program, or taking medication worried about the side effects down the road, you have to weigh for yourself what's more important to you. And, maybe even giving one or the other a try may be a good fit for you. So some people worry about dyskinesias, and dyskinesias are those involuntary movements that can often come with cycling of your Parkinson's, of your levodopa. And I wrote an entire blog post about dyskinesias, and Lauren will go ahead and put it below, but if it's a bookmarkable guide to dyskinesia, and it talks a lot about why it happens, how it happens, what you can do to prevent it, what you can do to treat it, the different types of dyskinesia. So if you're having some dyskinesias or you're worried about it, please read that blog post so that we can scale down your fears and help you take a more realistic look at your medications as far as dyskinesias go. Okay, so the next group of drugs I want to talk to you about is dopamine agonists. So brand names of dopamine agonists include Parladel, Mirapex, Requip, Neuropro, and the Apokine injection. So those are the brand names. It's funny, somebody just asked this. The generic names are bromocriptine, Pramipexole, I always say that right, Pramipexole. Hey guys, I stumble over these too. Ropinirole, and apomorphine, which is the Apokine injection. So let's see, Ed asked about Pramipexole, and that is a dopamine agonist. So a dopamine agonist works directly by simulating dopamine receptors in the brain, simulating dopamine to the dopamine receptors in your brain. So it mimics dopamine, versus levodopa replaces something that produces dopamine. So if that makes sense, it's like it pretends to be dopamine instead of actually being dopamine. And initial symptom control with dopamine agonists is not usually as good as it is with levodopa. Dopamine agonists can be used by themselves. I have notes here, which is why I keep looking down. Dopamine agonists may be used alone as an initial treatment for those diagnosed with Parkinson's under the age of 65, and they can postpone the need for levodopa down the road. Maybe 2 or 3 years later, most people switch from a dopamine agonist over to levodopa, and the mindset there is that taking a dopamine agonist actually reduces the chances of developing motor fluctuations and dyskinesias. And so it typically is used as the first attack if you're less than 65 years old, and then potentially switching over to dopamine treatment down the road. So the use of dopamine agonists rather than levodopa appears to postpone the onset of motor complications and dyskinesias, like I just said. But they do come with some side effects. So if you're taking a dopamine agonist and you're feeling really sedated, you're having swelling in your legs, potentially visual hallucinations. The big one about dopamine agonists that's important to recognize is that they can often cause impulse control disorders. So compulsive shopping, compulsive sex, compulsive gambling, those types of impulsive control disorders can often come alongside dopamine agonist treatment. So it's really important to recognize the symptoms of that and be aware that that could be a side effect, so you can talk to your physician about it should you start to have some of those symptoms. Okay, so hopefully that answers your question about Pramipexole, my favorite word to say, Ed. Okay, so the third group of medications, we're moving right along. If you've got questions, put them in the comment section. We're talking about, if you're joining late, we're talking about Parkinson's medications, when's the right time to start taking them, and what they are exactly. So the third group of Parkinson's medications are enzyme inhibitors, which can be MAOB inhibitors or COMT inhibitors. And what that means is taking these medications, the aim of these medications is to prevent the breakdown of dopamine in your system. So they don't act as dopamine, they don't replace dopamine, they simply take the dopamine that you're already taking from likely another medication and try and protect it so that it actually gets into your brain. Because only about 10% of the dosage of levodopa will go into your brain. Will cross the blood-brain barrier is the lingo there. So MAOB inhibitors include things like selagiline, rasagiline, and sulfonamide. You might also recognize Azilect as a brand name there. COMT inhibitors, I feel like, are a little less common, but that's the brand name Tasmar and Comtran. So I see those less and less, but that's just in my practice. And they usually are used in combination with levodopa treatment. Like I said, it's just trying to protect that dopamine in your system. And why you would take an MAOB inhibitor would be to improve your motor symptoms early on in the progression of your Parkinson's, and it could also reduce motor complications in the long run. Because the idea there is that it protects dopamine from breaking down in your system instead of in your brain. When dopamine breaks down in your system and in your periphery, which just means outside your brain, that's where a lot of the side effects can come into play. So the idea of the MAOB inhibitors is to protect that dopamine long enough for it to actually get into your brain and minimize how much is absorbed in your periphery. So COMT inhibitors are typically prescribed with more advanced stages of Parkinson's to help you manage your on-off fluctuations if those ever become severe. So those would be types of things that an inhibitor, an MAOB inhibitor, or your COMT inhibitor would be taken. So that is the third class of drugs. I want to give you guys kudos for sticking around. I know this is pretty heavy medical jargon, but it can help you a lot when you're trying to figure out what your best plan of attack is. You know, your physicians are going to throw all these words at you, and it's good to be prepared when you walk in there. It can be overwhelming, and so hopefully we can dust some of the dust off of these big words so you can digest them and feel empowered when you walk in that clinic. When you have to make that decision and you have to ask those questions about, why am I taking a dopamine agonist? Why am I taking, why can't I take something like levodopa? What do you know about these enzyme inhibitors? Knowledge is power, you guys, and you guys need to maximize the amount of information you can get out of your very short time period with your physician. So just my soapbox, I'll hop off. Okay, so here's the fourth class of medication, which is they're called anticholinergics, and they may be recommended to treat something like a tremor if you are less than age 70 or if you have significant difficulties with walking. I don't see anticholinergics prescribed a lot, but I will read you some of the generic names for anticholinergics. Biperdin, benzotropine, obviously, trihexylphenidol. Yeah, wasn't a physician for a reason. Okay, so those are some of the generic names for something like an anticholinergic, but sometimes these are given alone or in combination with levodopa or dopamine agonists in people with more advanced Parkinson's disease who have a persistent tremor. So those are anticholinergics. Again, they're not super common as far as I've seen, but if you're taking one, that's probably why you're taking one. Or if you are over the age of 70, if you're less than the age of 70 and you have a tremor that's really not responding to anything else, they may try an anticholinergic with you. Okay. Then we have our fifth and famous Amantadine. And I feel like this gets prescribed quite often. Maybe that's just the pool of clients that I see, in Austin, but Amantadine is also called Simitrel, and it was an antiviral drug, which is really interesting, that they found actually helped to lessen Parkinson's symptoms, including tremor and rigidity. And so oftentimes you'll see or you'll hear your physician recommend pairing Amantadine with a carbidopa levodopa to help you reduce your dyskinesias. So again, dyskinesia we talk about a lot in the blog post that I wrote that Lauren's posted below. But amantadine is given in combination typically with a Parkinson's medication. And given by itself, I haven't seen a big reduction in symptoms. And I think the research supports that as well, as far as being a primary treatment medication for Parkinson's symptoms, like I said, as a primary treatment. Its main goal is just to help you reduce your dyskinesias over time. So those are the 5 areas of Parkinson's medications. I hope that was really helpful for you. I would love to hear what advice you have for other people with Parkinson's who are going through their medication journey, or any questions that you have about what to consider. Again, I can't answer specifics to your program, but I can maybe help you find some resources, and our community knows so much. So if you want to continue this conversation, we do have a private, free Facebook group where people can get a little bit more personal. I can get in there and be a little bit more active with our community, and it's called The Invigorated Community. It's over on Facebook. If you just search for it, you should be able to find it. Lauren is our beautiful community manager. She'll be able to get you in. You just hit request to join and hop in there and ask for other people's opinions. I know we have a lot of conversations in there now about reducing Parkinson's medication, trying these different types of approaches for their Parkinson's medication, and you guys have so much experience and a wealth of knowledge to share. So come over, join our community. Lauren will put the link in the comment section below. And then if you found this video helpful, I would love it if you shared with someone who you think may benefit. The more people that we can inform around their diagnosis, the more power that you guys have. And I always love to help do that. So make sure that you like Invigorate Physical Therapy on Facebook if you don't already. And you can also subscribe to our YouTube channel. All of these videos will be over on our YouTube channel as well. That's Invigorate Physical Therapy and Wellness on YouTube. So again, before I sign off, I just want to reiterate how important it is to combine medication with your Parkinson's exercise program. Medication alone does not slow the progression of your Parkinson's disease. It only helps you address your symptoms, and so exercise should be your number one medication for your Parkinson's symptoms. When you sign up for the 30-day challenge at invigoratepte.com/30-day challenge, you get a starter kit from me that has a planner, tons of exercise videos, motivational tips and strategies from me on how to initiate your exercise program in a way that's sustainable. And then you get weekly emails from me once or twice a week, checking in, seeing how things are going. You have the support of myself and Lauren and our invigorated community, because exercise is literally the very best medicine that you could possibly be taking, and something I'm really passionate about. I've really changed my life around helping spread that awareness all around the globe. So I would love to have you be part of our movement challenge, or invite someone else to do the movement challenge with you. That would be wonderful. So like I said, we've had almost 1,800 people join the challenge, which adds up to about 2 years or more worth of exercise hours. So, which is pretty amazing. We've gotten over 2 years of pure Parkinson's exercise going just from that challenge alone. So I would love to have you be part of it, and hopefully I'll see you inside the challenge. But until then, I would just say keep moving, and I'm sending you lots of big hugs. All right, bye guys.